Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
Hi, my name is Seth. I'm a nurse transfer in London, but based in Cambridge.
The NMC OzKey is changing, and our course is changing too. From this summer, the NMC OzKey is going to be 10 stations, and we've got 10 rooms to match. Practice every station in our state-of-the-art Central London Training Centre, or connect with the centre through VR from wherever you are in the world. 10 stations, 10 rooms. Yes, the number you need is 0203 637 6722. That's 0203 637 6722. To your success.
Manong knows best.
Normally change to scrub suit, visit the ambulance, do the final checks before proceeding to a job if there is. If there's a job, a usual transfer of patient in and out of London hospital will take 2 to 3 hours. I love this job because of the adrenaline rush I'm feeling whenever I'm inside of it, and at the same time, I tend to meet a lot of nice people across London. After all of the jobs, we normally finish at 8 o'clock in the evening. Mostly, transfer nurse, we transfer one patient from one ITU to another. It can be a time critical transfer, which means a specialized procedure needs to be done in a specific hospital. And the second is repatriation. So most of the patient being transferred to a specialized hospital needs to be transferred to their mother hospital. That's what we call repatriation.
Manong knows best.
I was a trauma nurse po, trauma intensive care nurse in one of the centers in the East for 3.5 years. And then after that, I moved to Central London. So there's like a hospital in Central London that caters mostly thoracic cardiac patient, oncology patient, and hematology. I just lasted there for like 2 years and 1 month. And then after that, I just became a bank staff. So I'm also a fashion student currently in British Fashion Academy. So I'm doing an immersion or post-diplomat studies for my portfolio, and hopefully I can make it next year to University of Arts of London. Also, I'm also an entrepreneur. So if you guys wanna see my shop and buy some silk scrunchies or pillowcases, the name of my shop is sefidesign.etsy.com. As a London fashion student, over a month ago, I quit my job just to pursue fashion, and basically, I'm happy about it. My school, we normally like start around 9:30, and then we are tasked to make a skirt. So we were taught how to do measuring, and at the same time, making a pattern, and then making a skirt itself.
Manong knows best.
Opo. So basically, meron pong 2 years or like at least 2 years experience of either intensive care background, A&E background, or ODP. Tapos meron po sa mga hospital natin na inter-hospital transfer training or like hospital transfer training program. So basically, it's like a 2-day program na kailangan nyo pong makuha para maging requirement or para makuha nyo po yung requirements as a nurse transfer dun po sa pinagtatrabaho ko po ngayon.
Hi, Manong George po. And I am a Filipino nurse dito sa UK for over 10 years. Now, kung katulad ko kayo na nagpapadala buwan-buwan sa Pilipinas, might I suggest to you, TapTapSend. TapTapSend is free, mabilis, maaasahan, and if you use our code on your first padala, Pinoy UK, you get £15 top-up sa iyong unang padala. So ano pang hinihintay ninyo? Send money to your loved ones, use TapTapSend, and use our code, Pinoy UK.
Manong knows best.
Basically, because I'm doing a bank shift, there's a lot of flexibility, especially I'm studying. So it's really difficult to juggle school, fashion school, and bank. Like work. So because of the flexibility, I was able to perform two specific duties at the same time. Two specific duties on a separate time in the best possible ways. At the same time, marami po kasi kayong makikilalang tao. So, different background, different culture, very diverse. So, kapag mag-work po kayo sa nurse transfer, marami po kayong knowledge na makukuha
Dahil nga po, iba-ibang background, iba-ibang technique, mas lalong gumagaling po kayo. Yung pangatlo po is, since bank, I will not say the rate, pero mas mataas po siya sa usual rate na nakukuha po sa bedside nursing. Kaya mas preferred ko po siya. Tsaka yung pang-apat po is lahat po ng nakakatrabaho ko so far ay mababait po. Kaya wala pong reklamo in terms po sa pagtatrabaho as nurse transfer. Yung cons lang po is that there's a possibility na magiging nurse-led transfer po siya, which means 2 nurses in 1 ambulance. Pero pag may nag-step up po na doctor na say, I can do the job, then there's a possibility that your shift will be canceled. Tapos yung pangalawa po is there's a lot of flexibility in terms of transfer and there's long-range transfers. Kapag na-assign po kayo sa mga long-range transfer, I think the farthest that we've been is Scotland. So kapag na-assign po kayo sa mga long-range transfer, there's a possibility that you're gonna end up late in terms of going home. But otherwise, the extra shift or extra hours that you work, it will be covered and you'll be paid. Tapos, minsan, aside from cancellation and long range, nakakapagod din po siya. Kasi nga po, matagtag po yung ambulance.
Slow down. Slow down. Please slow down.
So, kapag hindi po kayo sanay dun sa tagtag ng ambulance or dun sa bilis ng ambulance, there's a possibility na mahilo po kayo, magsuka. So, hindi po talaga siya recommended dun sa mga taong may ganung effect po sa kanila yung mga travel. Tapos, critical thinking. So, dito po kasi, kainan talaga siya. I mean, mababait po yung mga tao, pero kasi kung ang critical thinking nyo po in terms of like transfer is not snappy or hindi po kayo mabilis mag-isip, I suggest that you do the training first bago po kayo sumabak dun sa nurse transfer. Kasi it's very critical and at the same time, there's only 2 of you, nurse and doctor. So, minsan yung makakatrabaho nyo po is not experienced enough. So, ang nurse po yung sasalo. So, mas magaling po na meron po kayong enough background, enough experience para kung sakaling ganun man po yung mangyari, is safe pa rin po yung pagka-transfer ng patient from one hospital to another.
Manong knows best.
So, I strongly suggest if you wanna opt in to doing transfer job, una, kailangan talaga ng experience kasi at the end of the day, it's about how you think and how you deliver a patient from one hospital to another safely. At the same time, if you have enough experience, then mas madali po kayo makakapag-isip, mas magiging creative po kayo, mas magiging safe po kayo as a nurse transfer. Pangalawa, I strongly suggest do the requirements after you get at least 1 to 2 years of Band 6 experience from ITU, A&E, or ODP background, do the inter-hospital nurse transfer. Yung mga usual na ginagawa natin inside of the hospital, CT transfer, X-ray transfer, makakatulong po siya para maging mahasa po yung capability nyo to transfer patient from one place to another. Pangatlo, you need to have the confidence because dun sa nature ng nurse transfer, it's all about confidence, knowledge, skills, and attitude. Lahat ng tao mababait. Pero at the end of the day, is how you think, is how capable you are to safely transfer a patient from one hospital to another.
Always remember, Manong knows.
Manong knows best. Put your worries to rest when staying in the United Kingdom. Manong knows best.